Hi everyone, today we're doing a neurotoxin treatment. We are treating her frontalis, her glabella, as well as her crow's feet or her orbicularis oculi muscles. So we are starting up on her frontalis, and this is the muscle that elevates up our eyebrows, and this is how we form those horizontal lines. So here I have her lateral borders marked just to ensure that we're getting a nice spread across the entire muscle, and we're getting all of those muscle fibers so we don't end up with a spocked brow or anything like that. So I am just going straight across, evenly distributing my product. Here she got a little bleeder, but that is totally okay. And I just wipe it up here in a second. But as you can see, I'm injecting very close to that lateral border, and that line is kind of marking our temporalis line as well. Anything past there is just her temporalis muscle. And now we're moving on to her glabella. I have those lateral tails marked to make sure we're not treating outside of those. If we're treating outside of there, or if we're too deep, we might end up hitting frontalis and dropping a brow. So we want to make sure that we're really careful about our placement. But I just went ahead and cleaned her up a little bit, and here we are going into her proceris. I like to pinch up that muscle and hold as I'm injecting just to make sure that product is going where I want it to and not diffusing to other areas. Here we are in one of her corrugators, and as you can see, I have my thumb kind of pressed up underneath her orbital rim. Again, just to ensure that we are placing the product where we want it and it's not diffusing anywhere else. Again, that frontalis lies right underneath, so I was very careful not to go the entire depth of my needle. Now we're moving on to her crow's feet. I had her go ahead and express and just make sure that I liked where I had my injection points placed. And we're always injecting outside of that orbital rim, so again, I placed my finger there and just double checked prior to injecting. And these are very, very easy injections. As you can see, my needle is sliding right in. I chose 3 injection points for her. We are always injecting where we're seeing that movement. We don't want the patient to end up with a shelf-like look if we're treating some of the muscle and not the rest. So wherever we're seeing that movement, we're kind of following it along in a circular pattern right around the eye. And I'm doing the same thing on the other side. I'm pulling that skin taut, making sure that I don't see any vessels in the area that I'm injecting. And we're also always injecting away from the eye. We are also treating her masseters today, so I'm going ahead and checking my placement right prior to injecting. For this injection, we were being careful to make sure we're a little bit more posterior due to the risorius muscle coming from the corner of our mouth. That is when people end up getting a soft smile, is a common term for it. If any of that product diffuses to the risorius muscle, you can't pull your smile all the way back. So we're just being careful that we're staying right along that mandible, about 1 centimeter or so above and a little bit posterior to avoid hitting those muscles.